we feel that palliative care is a human right issue. Patients who need it must get it. It's not an optional.
Prevention, screening, education is preceded by this. I think the cost of the treatment of cancer can be reduced, substantially.
So you're basically making a fine point that prevention and early diagnosis is not a good in itself, but also is a good in terms of reduction of overall costs.
Yes.
In our country, of a 1.3 billion population, we have only 22 cyclotrons.
For 1/6 of humanity, there are only
22 cyclotrons,
Okay.
out of which I think 2 or 3 are not working, so 19 are functioning.
Right.
And the cyclotron followed by PAT, it's supposed to be the gold standard along with biomarkers, right? So if you don't see the availability happening there, where do you see the accessibility coming in? And therefore, if you don't see the accessibility, where do you think the person or the patient is going to enter the therapeutic cycle earlier than we expect him to enter as a system?
I believe that we are 70 years past independence. So what we have to do in a sustainable manner. We don't have much time to again experiment and again see whether it does work or not.
When we go into precision medicine, we are providing a cost factor to the patient and avoiding the unnecessarily expense that patient might have because of treatment failures.
I think we also need to work on bringing innovation to the healthcare system. So in order that patients also can access that, even if the drugs are affordable, not everyone can access it at the end of the day.
The best that is available also keeps on changing. And there is also something called a diffusion asynchrony. Anything available is not immediately available to all. Therefore, we cannot discard the concept of good enough, because we will have to keep on the good enough for those who are not able to afford the best.
This conversation is critical. Overall, if we don't have it, the cost of not having this conversation is going to be far bigger than the cost of doing something.